Hey, this is Tim Reha here live at the Digital Health Summit Studio 2014 CES, sponsored by Ideal Life. We got a good friend of mine that came all the way down from Seattle, and we had to do a little special mission today, go down the show floor and kind of check some things out and then come back up. This is Dr. Sanjay Kumar, CEO and founder of RTneuro. Good to see you.
Hi Tim, good to be here.
So we're working on a project in the Northwest called healthwearables.org, and we'll go into that. It's just kind of an event we're producing. And then I was curious to just kind of get your perspective coming into CES with kind of a blank slate, and what are you seeing out here?
You know, CES is filled with people who have built wearable devices. Wearable devices have gone from being pedometers like Fitbit, FuelBand, and Jawbone, are the ones that you probably know of, to starting to have other sensors like heart rate sensors, which Polar had invented a long time back, but now they're getting incorporated into the device itself. Now that changes the game a little bit, but there really has to be a combination of applications, cloud-based computing, interesting mobile apps, and until all those things really happen, it's going to be a toy.
Yeah.
And so, we have to make that transition.
So everybody can't do everything, and we kind of had a conversation about this. So what's going on with the whole stack in what you're seeing here at CES?
That's a very interesting point, because when you try to do the whole stack in an emerging industry, you tend to be very frugal with where you put the resources, and so you're distributing, you're creating a minimalistic product, right? And what we really want to see is we want to see specialized players, people who are really good at developing hardware, build hardware, and we want to see people who understand data and cloud and analytics to do the work in the cloud. And so you really need to see that stratification in the business. It won't happen for a little while, mostly because I think the big players are waiting and watching to see where they want to jump in.
Yeah.
But I think it has to quickly accelerate towards that. Otherwise, you're going to see this sort of fatigue with the current set of devices.
From the customer standpoint, because they're not getting a great experience, to also people just running out of steam without deep products.
I think from both sides. If you look at many of these companies are now funded, the investors are expecting to see things really change, and unless the customer sees a reason to really use the product and have it make a difference in their lives, it's not going to do a whole lot. So, the best and most interesting thing about Fitbits today is that people put them on their pets, and that's very exciting. But that's really not going to change the industry. Right? Yeah. So what's going to change the industry really is to have some very, very strong players come in and say we're going to build really great wearable devices, which means we're going to have integrated sensors. We're going to have it be extremely reliable. We're going to make sure that it is something that people are going to get excited about. It's not just a fad. It's not something that my neighbors got it, I got to have it. It's got to be, hey, it's really changing my life. Yeah. And so that's, I think, where we're going to go.
So, yeah, we get all this data off of all these different sensors, and then it's like, what do we actually do with it? There's a lot of, you can hear right now, it's almost like there's so much going on here, and hype, but what's the hardcore reality?
Yeah, so the reality is that we've got the data. We've been able to extract the data from the human body. Whether it's temperature data, whether it's heartbeat, whether it's even ECG. Certainly, we've got accelerometer data. We know how to manipulate that data, but we still do not know how to make it relevant to life-changing experiences. And people are looking to have life-changing experiences from these devices. They're not looking to be told, that, well, I walked 50 steps, or I had a great night's sleep, or I sat down for 2 minutes too long. That's really, it's very shallow. And really that's, so how do you make that quantum leap? I think it's going to be with the involvement of a lot of people from the medical community and people from the rehab community that essentially understand the interaction that the patient wants, the input the patient wants, the advice the patient wants, and they're going to build those applications. And those applications are going to require a lot of interesting computing from the cloud. And it's when all those things come together that you're going to see people feel really good about what they have.
So as we hit 2014 and kind of getting your perspective down on the floor, where are we at now, and what do you think the future is going to be like the next 1 to 2 to 3 years?
Well, 2015 is going to be much better because 2014 was all about saying, me too, right? Hey, look, I've got a very fancy band, right? Look, I can use Bluetooth low energy. And that's the funny thing about Bluetooth low energy. There are no phones that can talk to it. So, even though you have these bands, you need a tablet. There are only a few tablets that can talk to it, very few phones talk to it. So 2014 really is a time of saying, hey, I'm a player, and people finding out if they have the strength to stick around. 2015 will be the time when you will see a couple of people emerge who will say, listen, I've been working on these algorithms. They are game changing. We've got all these medical folks working with us. It's an evolutionary process that I think we don't have the next 5 years to do. We've got to do it now.
So in Seattle at the Health Wearables event that's going to be in June coming up, what kind of folks would you like to invite there?
Oh, that's a very good question. I think first of all, it's great that we're going to try to put an event together that is focused on wearables. I think we need to really look at people who are going to talk about the cloud specifically. They're not going to worry about where the data comes from. They're going to tell us, hey, listen, if you were to give us data, this is what we can do with the data. So we need those kind of folks. We need people who are really good engineers who can say, listen, here is how I would make a product or build a wearable that can give reliable, accurate data, low power, flexible. So we need those kind of people, and we need people who are going to be very good at working with patients. So we need to have people from the medical community represented there too. So I think when you get all those people together, you're going to hear some great ideas.
So we're going to pull together the Northwest ecosystem from Vancouver, BC. We actually have some guests who speak on the panel who are going to pull from there, and you're invited to connect up. Check out healthwearables.org. The website will be coming up soon. This is all very new. And Twitter is @healthwearables. Alex, our friend, does the Health Wearables. What's going on up in Seattle for different wearables and health tech events?
I think well, hopefully Alex will be putting up some posts very soon. But I think the Seattle is great because it's got a lot of people with a cloud background. We've got Amazon, we've got Microsoft. They are looking for applications. We've got a bunch of startups, very, very early stage. I think Seattle should focus on its real strength, which is building great software, whether it's on the mobile app side or the cloud side. I think we're going to see a lot of that.
Cool. Anything else? RTneuro?
Well, we started with verticalizing everything like everybody else. We quickly realized that the value is in the cloud. It's the algorithms, it's the ability to tell people information that they want to hear, and so hopefully we'll come up with something interesting there.
Cool. Well, it's always good to see you. And what are you going to? What are the rest of your plans for CES? And we'll end there.
I'd like to rest a little bit after having walked 3 or 4 different floors. But CES is great. A lot of excitement. Not a lot of great products necessarily, new products, but home automation. Check it out. Driverless cars, very interesting.
Cool. All right. And how do people connect up with you?
You can email me at sanjay@rtneuro.com. Anytime. Look me up on LinkedIn, Twitter. I'll be there.
All right. That's Sanjay Kumar here live at the Digital Health Studio at CES 2014. Thanks.